Residents of Barberton community in Mpumalanga will now have access to quality healthcare services at their doorstep. This has been made possible by mining company Barberton Mines, which has built a state-of-the-art clinic in the area as part of its social labour plan. Mineral Resources and Energy Minister Gwede Mantashe, together with Mpumalanga Premier Refuwe Mtweni-Tsapane, would hand over the clinic to the community this morning. Newzroom Africa's Mweli Masilela is there. Mweli, surely this clinic will make a huge difference to this community. Very good morning.
Indeed, Hugo, this clinic is going to make a huge difference in this community, which is Extension 13 here in Barberton, especially for elderly people who had to travel long distances to actually access healthcare services. So now the state-of-the-art clinic just behind me has been made possible, or has been delivered because of a partnership between the Department of Mineral Resources and Energy as well as Barberton Mines. Actually, they are the ones that invested some funds to build this clinic. So quite a number of community members will now not have to walk or travel those long distances to access the healthcare services. So we're expecting the Minister of Mineral Resources and Energy, Gwede Mantashe, as well as the Premier of Mpumalanga, Refuwe Mtweni-Tsapane, to come to this particular area this morning to hand over this project. We know that this is not the only project that has been handed over by the Minister of Mineral Resources and Energy, Gwede Mantashe. Just a few months ago, he was in Milibek, where he also handed over a clinic that was built by a mining company as well, Exaro. So it looks like these are some of the projects that are now gaining momentum in terms of the mining houses, trying to make sure that they plow back into the communities where they are operating. But the last time we spoke to the Minister, Hugo, he raised concerns to say that there are still those mining houses that are not complying in as far as the social labor plan is concerned, saying that, well, that is an issue that they are looking into as a department, because you find that sometimes in different communities there are protests, people calling for employment, and also some facilities like this ones. You find that those mining houses or companies are not delivering those projects. So it's a matter that the minister, during that time when he was handing over a clinic in Milibek here in Mpumalanga, it's a matter that he raised as well.
Have you had a chance to converse with some of the residents of Barberton, just to get a sense of how they feel, how valuable is this new addition to them?
Yes, indeed, Hugo, some of the community members that we've spoken to here, they are saying that they are grateful to have this facility now. As I've said, that some of them had to travel those long distances to access quality healthcare services. But we know that one other concern, which is not only unique to Mpumalanga, there's the issue of shortage of staff that many health facilities are confronted with. So we're going to hear, in terms of the plan here, especially from the side of the Premier of the province, Refuwe Mtweni-Tsapane. We also understand that the health MEC, Sasekani Manzeni, will be here. So we'll try and get that information in as far as the issue of staff is concerned, because sometimes residents feel that even if they do have this state-of-the-art facilities, you find that there is a shortage of staff, which then doesn't help in that particular situation. So we're going to hear in terms of the plans, in terms of ensuring that there is enough staff that is going to service the community, and also not only about staff alone, also the issue of medication. Sometimes you find that there are shortages. So those are some of the issues that we'll also look into, Hugo, as this clinic is being handed over. That is the Capital Clinic.
Some interesting issues you talk about. Certainly you mentioned that it's a state-of-the-art. Mweli, have you had a chance to go through the hospital, the clinic, and just assess some of these features, state-of-the-art features that you talk about, or is it something that you will be doing a little later on this morning?
Yes, Hugo, it's something that we'll be doing a little later on, because what we're expecting is that when the Minister and also the Premier and as well as the MEC for Health in the province arrive here at this clinic, they'll go into a briefing so that they can get the details in as far as how many community members exactly are going to benefit, because we know that Barberton is quite an extensive community, so we'll get those finer details in terms of the number of community members that will be serviced by this clinic. And then we're expecting that after that briefing, we'll then be taken on a tour just to see the facility. But I can tell you, in as far as I'm concerned, the clinic that was handed over by the Minister Vaccination in Middelburg, it looks like it has got all the necessary facilities that many community members will need in terms of accessing quality healthcare. So we're expecting nothing different from what we saw during that handover. So, of course, the Minister and also the Premier will be giving those details in terms of what exactly will this clinic offer in as far as those healthcare services are concerned, Hugo.
Well, is there any indication that this will be a vaccination centre, certainly in the next few days, once the former proceedings have been done away with?
Well, what we know from the Department of Health is that they've been trying to have as many vaccination sites as possible, even as we speak now. Just yesterday, the MEC for Health, Sasekani Manzini, was visiting some of the vaccination sites in Mbombela. In fact, there was a campaign by bikers in partnership with the health department in the province to try and encourage people to vaccinate, because we know that in as much as there has been progress made in this vaccination rollout or vaccine rollout, there are still some people who are hesitant to take their shot. So what was happening yesterday is that those bikers were actually on the streets of Mbombela trying to encourage people to take their jab. And some of those bikers actually led by example, Hugo, because we know that already in terms of the vaccination process, on the side of educators, about 80% of them have already vaccinated, but there are concerns to say that in terms of elderly people, they are not seeing much of them as per expectation showing up. So that is why yesterday they emphasized that young people, as they are going out to vaccinate, they mustn't leave out those elderly people. They must actually guide them to say that they must get inoculated, Hugo.
Finally, Mweli, before we let you go, the weatherman has said that there is a cold front in several parts of the country. Can you tell us what is the weather like out there in Mpumalanga where you are?
It's been very, very cold since yesterday, Hugo, and you can see even on social media, people are actually talking about the issue of the weather, but there's nothing we can do. That's nature, Hugo. Even if you can check the people that are coming through here, they are dressed warmly, showing that indeed the cold is hitting different parts of the country. But we are hoping that once the program gets underway, people will forget about the cold and try to think about the importance of this particular event today, the handing over of an important facility that has been much needed by this community. So we're going to see in terms of the program as to what happens exactly as it gets underway. Hugo, I hope on your side the weather isn't bad as it is this side, because I can tell you it is a bit chilly.
Yeah, I think it's chilly everywhere. Mweli Masilela, thank you very much for your time. Our reporter coming to us from Barberton in Mpumalanga, where Mineral Resources and Energy Minister Gwede Mantashe will do a handover of a much-needed state-of-the-art clinic to that community.